Welcome to another More Than Medicine podcast with Dr. Simone Josie, author, speaker, and physician. Listen in as Dr. Simone shares real-life, practical, everyday survival tips for all healthcare professionals. Let's join Dr. Simone now.
Hello, healthcare professionals. Welcome back to another More Than Medicine podcast with me, your host, Dr. Simone Josie. Today's episode, we are on number 29. This podcast is for all healthcare professionals, whether you are a doctor or a nurse or an administrator, whether you are a physical therapist or other specialist, you will find something helpful here on this podcast. Let me also welcome all of my returning listeners. Thank you so very much for your continued interest and support in this information. You know I do it just for you. And also I want to say thank you so much to those of you who are commenting and following me closely on social media, liking and sharing my information. It really lets me know that you're finding the information useful. So thank you very much. Also too, I'm sure I have some new listeners out there. This is your first time listening to More Than Medicine. Welcome. Stay connected. I love to interact with my audience, with my listeners. I do this absolutely for you. We know that our lives are so much more than medicine, and that's why I came up with this podcast, because there are so many conferences dedicated to the world of academia, which is, of course, very important to what we do, right? However, I found that there was not a lot of resources that spoke to the non-medical side of what we do on a daily basis. We give and give so often, but who helps us? Doctors and nurses and healthcare administrators. Who helps us? It's always good to know that you have someone who is in your corner, who is dedicated to helping give you a life that is more productive, more excellent in our patient care, more efficient in our patient services, and of course, someone who can help with work-life balance. So in a nutshell, that's what I do. Now, for those of you who may not know me, I am also a full-time practicing podiatrist. I'm also a professional speaker in the field of patient engagement and experience, as well as professional development skills for healthcare providers. I also speak on work-life balance, as I mentioned before. I also wrote a book, More Than Medicine, What They Don't Teach You in Medical, MA, Nursing, and PA School. And that is what I call a handbook or a manual for healthcare professionals when it comes to leadership skills and how to be more excellent and efficient with our bedside manner. So as you can see, I am extremely busy and I love doing everything that I do. I love being a wife, a mother, a physician, a professional speaker, an author. I love doing this podcast. It really adds to my life. So even though I am fortunate to travel and get paid to do all that I do, I honestly do it for the love of sharing and empowering, strengthening, teaching, enriching, energizing, and motivating other healthcare professionals to live on purpose. So this is my message to all of you out there who might be a part of a medical board. You might be in your own practice. You might have questions about ways to improve productivity and how to improve excellence and efficiency within your team. Let me know. This is what I love to do. Tomorrow, I'm actually headed to Tampa. I'm speaking at the PACOM conference, and so I'll be speaking to medical office managers. I'm really excited about doing that because it gives me a chance to, number one, serve my medical peers. And number two, it also allows me just to operate in my passion, which is helping other people through spoken word. So if you have a need for a speaker, please contact me. I do medical conferences. I also do office consulting. So I'm available to you. Okay. So my contact information is definitely here in the podcast notes, and I'm sure it will also be inserted throughout this podcast. So I'm accessible. I'm available to you.
Dr. Simone Josie is a practicing physician, thought leader, professional speaker, and consultant for leadership, professional development, and customer service skills. Contact Dr. Simone at esteem.speaking@gmail.com or by calling 513-205-6363.
Hello, healthcare professionals. Welcome back to our episode for today. As I mentioned before the break, we are on episode number 29. And on today's episode, I am extremely excited to be sharing with you an interview that I had with one of my esteemed colleagues, Mrs. Dorian Marsh. Now, I'm very happy to say that I have known this young lady ever since we were both in college. And so I was extremely happy to be able to reconnect with her on social media through an article that I posted. She commented on it, and I found out that she would be a wealth of knowledge for this very important topic that we're going to be discussing. Or for today's topic, we're going to be talking about cultural competency as healthcare professionals. So let me just share a little bit about Dorian Marsh. She is a 34-year-old wife and mother of two. She currently is employed as a family nurse practitioner in the skilled nursing, long-term care, and hospice setting. She's also been serving in the armed forces for 14 years and currently holds the rank of captain. Dorian Marsh received her associates from Bryant and Stratton College in 2008, her bachelor's from Cleveland State University in 2013, and her master's degree from Simmons College in 2015, all in the degree of nursing. For her, she describes learning as a lifelong process. In her spare time, she teaches a life group at her church in Cleveland Heights, Ohio, and she also volunteers on the board of Women of Hope, which is an outreach to veteran women, and Zeta Phi Beta Sorority Incorporated. She also serves there as the chair of Adopt a School and co-chair of the scholarship committees. Dorian says that her zeal for service and commitment goes beyond her daily work. She strives to provide compassionate, quality care in whatever service she encounters. So let's now join Dorian Marsh as our special guest for today's More Than Medicine podcast. Okay, healthcare professionals, let us get started. We're going to be speaking with Dorian Marsh. Dorian, are you there?
Yes, I am here.
Good. And how are you today?
I'm doing well this morning. Thank you for asking.
Good. Believe it or not, healthcare professionals, we are such busy women in healthcare and in our personal lives that we are up early on this morning making this interview happen. So I am so very grateful to you for taking time out of your busy schedule to be with us this morning. And I just know that our listeners are going to really benefit from your information. We were talking offline, and I am personally excited about this topic because it impacts all aspects of healthcare and all healthcare professionals. So even though I know that your information was specifically for cardiovascular patients, I mean, anyone in healthcare can get something from this podcast, all right? So I'm excited. I have my notebook and my paper and pen and all that ready to take notes. So, all right, we're going to go ahead and just jump into the information. So, Dorian, can you please just define cultural competency for us?
In a manner of speaking, cultural competency is the provider's ability to be aware and kind of sensitive to their patients' beliefs and attitudes and environment. So it's like the whole person approach, and it's related to their view of healthcare. Cultural competency also does not just relate to a person's ethnicity, but it also is their socioeconomic status, their education, their family indicators, and it really drives how compliant they will be, when it comes to a particular treatment regimen or a medication regimen in healthcare.
So it's more than just the demographics that we usually get. Most of the times our demographic sheet has, age, sex, marital status, and maybe religious background and a couple, a couple bits of information. But this seems as though it really goes deeper so that you can actually get to know, the patient, which I think that's great. So, as far as cultural competency, I mean, we see the words and it makes sense being able to identify with, your patients on a cultural level. But it's, from what you described, it seems like it's a lot deeper than just our basic demographics. So why exactly then did you decide to research this topic of cultural competency and, of course, have it affect your practice?
It all started with a little bit of research in Healthy People 2020 and finding out that a lot of patients in our communities and in our societies are bogged down with the comorbidities, diabetes, cardiovascular disease, and obesity. And too many of these patients are just non-compliant. They don't want to follow through with what the provider has ordered them. And I started to ask the question, why? Why is it something so simple that we give them directions and they come back and they still have the same lab results, they still have the same blood pressure, they still have the same issues? And it really boils down to they don't believe they can get better. So how can we as providers help encourage our patients to have more responsibility and take control of their health care? It really goes back to that cultural competency piece, understanding your patient's view of if they're going to get better, why they are sick, and how they can get better.
I like that because it's giving our patients the information and the empowerment to be involved in their own healthcare and rescue. And so often I feel like as a doctor, or even just, as in healthcare, we have such a big burden to save all of our patients, which is great because that's what we signed up for, but it's a two-way street. So I like how cultural competency takes into account, yes, what we do, in the white coat, but then also, what our patients are going to do. And you also said something that was really key. You said that sometimes our patients don't have the belief factor. They don't believe they can actually get better. And I know, just in my own practice, I try and do a lot of inspiring, even through all the prescriptions and the, all of the medication changes and all. I really try and inspire patients. But what I'm getting from you is that you can do that up until a certain point, but unless you're able to really connect with the patient, where they are, it might all be moot. So I like this, this whole cultural competency understanding that it's more than just seeing through our own lens as providers. It's actually trying to see from the patient's perspective. All right. Now, you did research. So how exactly did you conduct your research?
I started with conducting a literature review. So I wanted to see if there was even a lot of literature out there related to cultural competency. Do providers understand what the definition of cultural competency is? And in doing the literature review, we found that there is cultural competency documentation through the Agency for Healthcare and Research Quality, through the World Health Organization, but as it relates to actual providers using it, there wasn't a lot of correlating literature in that particular field.
Okay, so we know as providers that we should be connecting, but, are we really doing that? Are we taking the extra steps and efforts? Okay, and, a lot of that might have to do sometimes even with just, not having enough time, face-to-face time with our patients. I know on average for most primary care settings, it's like, under 15 minutes or so as far as face time, just because of scheduling and because of the other burdens of seeing patients. So, was that something that you found in your research to be a factor, to, like a preventative factor or preventing factor?
Yes, it kind of became a blockade, if you will. And it showed that because the United States population is becoming more culturally diverse, we need to improve communication, identify these issues early to help reduce the health disparities. Okay. In the 50s, that's when they started to really show that we need a new health belief model to help change the culture of the United States.
Okay, so in the 50s, so it seems like it's more, it's new, it's a modern thing. I've talked to some healthcare professionals, some of the, I would say, more seasoned providers, and sometimes I get the impression that they feel this is kind of all fluff, they don't have time for it, it should just be, I'm the provider, patients need to just listen because I know best. But I'm realizing now, that it's just not fluff. This is truly dealing with patient outcomes and actually being able to help our patients. And it's more than just, I'm the doctor, I'm the nurse, you should listen to me. It seems like it's 100% geared toward better patient engagement. And, of course, we know that's paramount for successful patient management. So I like it. Okay. All right. Now we're going to take a quick break. All right, and then after our break, healthcare professionals, Dorian and I are going to discuss her findings more specifically, and then we'll also share some ways that you can incorporate this knowledge of cultural competency into your own practice. All right, so if you're interested to find out more, keep on listening.
For free professional development resources, visit DrSimoneSays.com and click the free resources button. To join Dr. Simone's exclusive email list, visit DrSimoneSays.com. Your information is never shared, and we at Dr. Simone International respect your privacy.
All right, you healthcare professionals, welcome back to this episode of More Than Medicine. We are talking to Dorian Marsh. And before our break, we were talking about how she conducted her research regarding cardiovascular patients and patient engagement and cultural competency. So I would like to get a little bit more information about how you exactly conducted your research. And then, of course, let's talk about your findings, okay? Before the break, you were saying that you did a literature review, and then from there, what did you do next with your information?
Once we found out that there is a definition for cultural competency, there is literature related to how we should apply it, but not necessarily how healthcare providers apply it, then I decided that we should do a randomized survey to providers, all types. So we did nurses, practitioners, physician assistants, and physicians. And we did them across 3 states. We did Ohio, North Carolina, and Florida to try to get a very diverse pool of respondents. And what we found was a theme. In the theme, there was an understanding that cultural competence is necessary for giving good health care, but all of the respondents except for 2, and I had 29 respondents total, did not know how to apply it in their practice. So there was a gap. The knowledge is there, but how to use it is lacking.
I can imagine, even with, like I said before the break, there are probably so many barriers to actually incorporating cultural competency. And like you said before, the patient population here in the United States is just becoming so diverse. And I know here practicing in southern Georgia, sometimes there is a cultural barrier that has to be overcome, whether it's from my side with my patients or from my patients, being able to relate to me, or even just sometimes my accent can get in the way, or the patient's accent. So there's so many little subtleties that can really affect how excellent we are as providers. And so it's to me, it's kind of interesting that we all know, the majority of people know we should be connecting, but that, only, 2 or so, you say, were actually able to say that they could do that successfully in their practice. So then now how, I know your research was focused on cardiovascular, but I think that it can be, applied to all aspects of healthcare. So, whether it's administrative, as well as direct patient care. So tell me then, how can our healthcare listeners, how can they incorporate this information into their daily practice so that they too can achieve better patient outcomes?
I would say the very first thing has to do with looking at ourselves. What is our belief towards healthcare? Because we don't want to project our belief on someone else. Our own culture defines how we motivate ourselves, how we complete our own goals and tasks throughout our day. So we cannot project that on our patients. So we want to ask them, what is their belief in regards to whatever we're discussing? Their health care, how they're going to navigate the healthcare system, if we're an administrative, do they believe they can achieve what our goal is? And if the answer is no, then we have our starting block. We see, okay, we have to find their level, meet them at their level, and then raise them up. And then we will find that we increase compliance and improve their outcomes because they now feel like we're relating to them and we understand who they are, and they're not just another patient, just another person in our day, that we really care about them. That's patient engagement.
It's so interesting how you worded that, because there are so many times that you're going through your day, you're seeing a patient, and obviously, even if as a podiatrist, I'm looking at someone's foot, and there is a diabetic foot infection, and I'm saying, what can I do? What more can I say to my patient to actually have them be involved and concerned about their limb as I am? So, and sometimes you think, well, gosh, I mean, if there were, there's a sore, there's an ulcer, that would be something that's concerning. But you're right. There are some times when, that to them, I mean, they've seen their dad lose a leg, they've seen their uncle lose a leg, their mother. So for them, it's just a part of life, and they might not be aware of the fact that, hey, I don't have to be a part of that statistic. So you're right. Looking in the mirror and just saying, let me not project, because in my mind I'm thinking, okay, if there's a problem, let's fix it. But you're right. We do have to be able to relate to our patients and speak to them in words and in symbols or symbolisms that matter to them, and, because I have lots of, here in Southern Georgia, we have a lot of, hunters and fishermen and all of that. And because of that, I mean, say, hey, it's kind of hard to, be in a deer stand, hunting if you have no feet, if you have no legs, it kind of makes it a bit difficult. So kind of, using things that are going to motivate them personally, not just, hey, as a doctor, this is not really good, because that doesn't really make sense, to every lay person. So I like that. And then what else do you think we can do? So we, looking at ourselves, making sure we're not projecting onto our patients, but what else is there that you think we can do?
We also need to realize that the comorbidities are kind of linked, and they're influenced by more than just the person's belief. It's their environment, social, economic, biological factors. So we got to dig a little bit more, maybe talk to family members, get support for the patient, after we've kind of met them where they are, find support. How can we find resources to help them achieve their optimum self and change their view of themselves? Because it takes a family, and it's more than just, our view of what a family is. It's their view. Their family might not be biological. Do they have friends? Do they have a support group that they go to? Is there a community resource that they can get to? And then making sure they have access, in between their visits to us, because we may not see them that often. What else can we find for them to help encourage compliance?
Support systems is very important, very important. And sometimes I know that, patients come in and their support system, even just yesterday I was in with a patient and I asked a question. He was complaining of this sudden onset of, right foot pain. He's a diabetic with, neuropathy, and he has just this, a sudden onset of right foot pain. And so I'm thinking, scratching my head, I did my physical exam. I'm trying to think, well, what exactly could have just come, spurred this just out of nowhere? And his girlfriend is sitting in the chair, and she just starts saying, well, don't forget to tell them that you fell out of the bed 2 weeks ago. And I'm like, he wasn't going to say this. He was like, oh, yeah. And he's like, well, I probably did bump my foot, and I probably did, So for me, having family members and friends in the room can be extremely helpful at times, because they are going to act as not only support to the patients, but also to me as the provider. So that is important. So a lot of times, patients come in and it's just them, and so I like to ask, who lives with you, who helps you? So that is really true. And then you said, it's important for us to also make sure that we have resources available and we make the connection for our patients so that they can take advantage of those resources. So healthcare professionals, very important. You need to know what is available to your patients outside of just what you offer in your specialty or in your practice. There are resources out there. We have to know what's going on for our patients so that we can actually be able to provide that information to them. So this is really great stuff. Thank you so much, Dorian. Thank you.
You're welcome.
Now, do you have any experiences in particular that you can share with us?
I know I have quite a few. I work in several nursing homes, 6 to be exact, so I'm constantly interacting with patients, with families, from the range of 18 years old all the way through hospice years. So I know I have one patient in particular who was a female, and she had some comorbidities, obesity, cardiovascular disease. She had a spinal injury, and she only had her mom really in her support system, and mom was at work. And so she was in my facility for a wound, and she was in skilled nursing time, which means she's in for rehab and therapy. She's not there for long-term care. So she was very, very cantankerous, if you will, and non-compliant with medications, with staff, with dressing changes. So I come in, I introduce myself to the patient, and she goes, oh, what do you want? So already her view of me is negative. And it's probably because of other interactions with other providers that may not have gone the way she felt that they should go. And so I just kept a cheery outlook on the entire process. You want to make sure you're driving the emotions, because sometimes patients can kind of rub off on you if you're not very careful. And so I asked her, what did she think her most serious problem was, why she was there. And she asked me to just read her chart, so she did not feel much like conversation. So I got a chair, I sat down at her bedside, and I grabbed her hand. And I said, I am here to do my very best in whatever area you need me to help you in. We're a team, and if you want to get better, I want you to get better. So please tell me, how can I help you? And she just turned and looked at me, and she said, you're different. I said, I'm Dorian, but yes, how can I help you? And she goes, well, I'm really just, if we could get this pain under control. Nobody wants to listen to me. I'm just in so much pain. I'll take my medicine, but I don't even want to move. I'm in so much pain. So I said, okay, let me do a little review of your chart now that I know your primary concern. I'll come back with a plan. So I left. I spoke with the nurse. They talked about how she was a prior drug abuser, so doctors are very, very cautious. And we know that it's a huge issue in our country right now with drug abuse. So physicians are very, very cautious with prescribing any narcotics to a patient, and in fears that they are going to cause a trigger and that they will relapse. But I have a little bit of experience working in chemical addiction treatment. We're working at a methadone facility in Northeast Ohio. So what I did was I just contacted a doctor, and I consulted with somebody in that specialty, because it is not my specialty. So there's communication and collaboration going on for my patient. So that's a resource, that I'm using. And he gave me a regimen, and I won't go through that in detail, to start with the patient. I came back. I told her I had a plan. I explained the plan to her. And just knowing that somebody was willing to listen to her, engage her, find out what her issue was, and try to treat her instead of just brushing her off, changed her outlook. I got the nurse to come in, and while I was there, they changed her dressing. She took her morning meds. And so then I told her I would be back to review her case, later that week, because I see my patients 2 to 3 times a week in skilled care. And when I came back at the end of the week, different patient, happy to see me. Nurses report she's compliant with all of her meds now in treatment. I did not give her any narcotics, but just being able to relate to her and understanding her beliefs and not feeling that she was just another patient and that the stigma of her past is following her changed her outcome. So now her wound is going to heal better. She's going to get therapy. I can't say she will be at a fully functional level, but she's going to be at a higher level now because she's following through with her treatments and her medication.
That is so helpful. I mean, stories like that just bring such a smile to my face, and just it's a good reminder to us that there are so many times when we look in the chart, there's an alert that pops up, history of this and history of that. And you're right, sometimes it is easier for us to look through our own lens and say, oh, well, you know what, she has a history or he has a history of XYZ, so we're not even going to go down that road. But pain is pain. And if there's legitimate pain, with a legitimate problem, we do have to still address that problem. I know the patient population I serve, that is, an issue, opioid abuse and substance abuse. And so it's a good reminder for us, hearing this story and just seeing how you went the extra mile, which honestly that should be, norm. That should be what we all do. But just like you said, collaborating with a specialist in that field, and look at the impact you made on her life and her medical care and her total experience. I mean, you've truly changed her life. So this is, that's wonderful. That is, and so healthcare professionals, that's what we should be doing. This is the kind of medicine that we've got to be practicing if we're going to be culturally competent, if we're going to be excellent providers, if we're going to truly engage with our patients and improve the patient experience. And you know what else? Just listening to you speak and just talking about how even things changed with the staff, a lot of the complaints and concerns from healthcare professionals, it's also the working environment. We're talking about just, the employee experience. A lot of it has to do, yes, with coworkers and work hours and pay and, there's, policies and procedures, and there's so many things, but also just the work environment. And so if you have disgruntled, upset, non-compliant patients, that wears on healthcare professionals. That's a burden on the shoulder. So not only are we trying to practice good medicine and save lives and limbs and, all of that, but we're also trying to, navigate in a system where people are not well, people are ill, and that's a burden emotionally, and that can weigh on us. So then you also add in the other level of noncompliance and unhappy patients, and so it seems as though what you did was not only transform the situation for your patient, but also for the other staff members and team members. So that is far-reaching what you did. So congratulations on that. I'm sure, like you said, you have more. You have more stories and such. But now, just to wrap things up, you've given so much food for thought. It's and we have a lot to chew on for the future. But what, as far as a takeaway message, what do you want to leave with our listeners today?
Yeah, I would really like that all healthcare providers realize the importance of culturally competent care, and providing these services improves the patient's access to care because they want to seek health care now. It improves their communication with the provider, so they're being more forthcoming instead of withholding information now. And that improves their outcomes. We're building a trusting relationship, so that breaks down that barrier. They're no longer resistive to treatment, but they welcome the information, they're excited about it, and they make those critical lifestyle changes.
Excellent. Thank you so very much. Healthcare professionals, you heard it here. Dorian has shared some really good information today, and I am personally looking forward to just finding ways to incorporate what I've learned into my practice every day. And it doesn't have to be a big burden. It doesn't have to be this big monumental addition to your physical exam or even to your administrative tasks. This is what we're here for. This is what we're here to do. And so, cultural competency and patient engagement and improve patient outcomes, this is what we come to work every day to do. We just have to be intentional about what we're doing and really put our heart into it, because we know that what we do on a daily basis is so much more than medicine. All right, so thank you so very much, Dorian. I really appreciate your information. I'll have your contact information on the podcast notes. So healthcare professionals, if you're interested in finding out more about her research and ways to incorporate this information into your practice, please reach out. She is an expert on this. And so I want to make sure that you can connect with her. So reach out either to me or I'll have her contact information in the podcast notes, okay? All right, so healthcare professionals, thank you so very much for listening. More Than Medicine with Dr. Simone Josie and our special guest, Dorian Marsh. And until next time, healthcare professionals, remember, I will either see you at the top or from the top. You decide.
For a full listing of Dr. Simone's speaking topics and popular presentations, visit drSimoneSays.com. To find out more about Dr. Simone, visit drSimoneSays.com. That's www.drSimoneSays.com.